So, welcome back to the 1760 sessions where we talk to founders, building systems, and impact. As you all know, I'm Harry, your host today from 1760 Strategic AI, and I'm joined by Dr. Julius Torelli, founder of Gratefully Well, a holistic health education platform helping people transform their well-being through gratitude practices and evidence-based approaches to mind, body, and health. Julius's background, so he spent 40 years in cardiology, trained at Cleveland Clinic, founded one of the first integrative cardiology centers in 1999. Is that correct?
That's right.
And co-founded a health tech company that's raised over 50 million. Now he's channeling all of that experience, that 40 plus years, into teaching people what Western medicine often misses, how our emotions, thoughts, and gratitude practices directly impact our physical health. Julius, thank you very much for being here.
It's a great to be here, and I appreciate the opportunity, Harry.
Yeah, no worries at all. It's great to see you again. So Julius and I only spoke yesterday, and we were very excited to jump on. A bit of a tongue twister, that introduction, but it was quite lengthy, but we got there. So the first question that I want to kick off with is, you told me something that most doctors won't say publicly, and I think you know what this is going to be, that Western medicine, and we had a big conversation about this, is an illness-based model by design. So what happened in your last week of medical school of 1986 that potentially planted that seed?
Well, it really started there. I don't believe in coincidence. Everything seems to happen for a reason. And they didn't teach me how that universe works in medical school. But the last week of medical school, I was doing a family practice rotation, and I went in to see this one patient in the office, and she was a middle-aged woman who had nausea and vomiting for about 3 days, dry heaving, couldn't keep anything down. She was very dehydrated. We didn't know what was going on, so we admitted her to the hospital, and we ran some tests. We obviously gave her some IV fluids, and over about a 3-day period of time, she started to feel better. And when I went to discharge her, first I was going to be a physician like in 2 days. I was graduating, and I didn't know what to write for the discharge diagnosis, right? So I was like,
Yeah.
you have to have a discharge diagnosis. And my attending physician had told me, well, just put viral gastroenteritis. And so the first thing I learned that day was if we don't know what's going on, we call it a virus, and we just put itis at the end of it. It sounds good. And we always blame a virus. As I was discharging her, I was making some small talk as I was writing out her instructions. Yeah. And I said something like, well, we're going to get you home where you can get some real rest because you can't rest in the hospital. And she said, oh, I wish. I thought that was peculiar. I said, what do you mean you wish? And she said, well, I wish I could go home and get some rest. And I said, well, why can't you? And she says, well, in the last 6 weeks, my husband left me, my dog died, and my house burned down. And in that very instant, like all these thoughts started running through my head because intuitively it became obvious to me why she was sick. That was the first thought. The second thought was, wait a minute, I'm going to graduate here in 2 years and I haven't learned anything about this. So maybe this really isn't an entity. And then, I said, well, I have a medical school library entire medical school library I can go to, but then I wasn't even sure where to start to look for this, if it was something. And of course I was like, well, if I don't know what it is, how do I treat it? And so I was very confused, and didn't really know what to do with it at that point. It's a busy time. I was moving up to Cleveland, but that patient sort of stayed with me for the rest of my career. And as I progressed through my training, internal medicine, and then cardiology, and then into practice, some things started to become very apparent. And one of the apparent things was that we are very good. Well, first of all, in Western medicine, as you said, it's an illness-based model, and that's how it's set up, right? People wake up in the morning, they have a headache, they do their own thing, right? They take some Tylenol or some aspirin or Advil or what have you. It doesn't get better. Maybe it's recurring. They go to the doctor and they expect two things from the doctor, right? They expect him to figure out what's going on, and they expect him to fix it, right? And so we turn all of the responsibility of our healthcare to the healthcare provider, whoever that sort of is. And in the acute situations, that works pretty well. In other words, sort of when especially if we find something physical. So you have a broken bone, you have a belly pain and appendicitis, or belly pain and maybe a bad gallbladder, you're having chest pain and a heart attack. We can go in and open up that artery. We can cut out the appendix. We can, set the bone, or we can pin it, whatever it is, and it works. And that's great. But what I also found was that the majority of patients who go to see doctors don't have these acute sort of symptoms or illnesses. They have more chronic complaints. They have recurrent headaches, belly pain, neck pain, back pain, chest pain. And we do all of our tests and we don't find anything physical, right? So most people who have headaches, as an example, don't have a brain tumor, right? And so we see them, we rule out the brain tumor. We do maybe an MRI or a CT scan or something like that. We see that there's nothing abnormal. And so that's our first tool in our toolbox is procedures, right? And so if you have a brain tumor, let's say, you might need a procedure. But if you don't have anything, we take that tray out of the toolbox, and the only thing left in the toolbox for Western medicine in general are pharmaceuticals, right? So we then start with, developing medicines to prevent migraines, developing medicines to treat migraines. If you get people with migraines, maybe, we know that they're stressed. So I like to call this sort of emotionally related issues. These are also termed medically unexplained symptoms or illnesses that people have where we don't find a physical finding. And so we just use our medicines. And the medicines, and like an irritable bowel, which is another sort of poster child for a medically unexplained symptom, is, the medicines are not really very effective. And so trying to put all that together, it became clear to me that we in Western medicine focus virtually 100% on the physical. And if we find something physical, we're actually pretty good. If we don't find something physical, we ignore all of these other, what I like to call non-physical dimensions of health, which are things like, mindset, mental health, behavioral health, emotional health, spiritual health, social health, cultural health. These sort of things it's not that we don't know they're important, we just don't know what to do with them, so we tend not to really concentrate on them.
Look, and it's just, what I'm getting from it is just, beyond your diagnosis, there's always going to be a bigger picture that the doctor's unable to see what it is. But the way you talk about it, to me, it makes it feel very obvious that we should already be thinking about this. But historically, medicine doesn't actually think like that. And it's developed to solve a certain pain.
So I've thought about this a lot, as you can imagine, and you're right. And I think part of it is, so there was a physician named William Osler back in the late 1800s. He was an American physician, very bright, very caring, brilliant guy, who was sort of thought of as the father of modern medicine. And he made a statement. They said, we really have to follow the scientific principles in medicine. And when he said that, everyone agreed, and it makes sense, right? Because there was, and still continues to be, a lot of charlatans out there, a lot of snake oil, and things like that. So prove something works. Okay, well, that makes sense. What has happened, though, in whatever it is, 200 years, 150 years, is that in science, you have to measure something. That's the key, right? And then look for changes. Well, if you're going to measure something, the physical findings and changes are easier to measure than anything that's sort of psychosocial, right? Yeah. So if you look at, let's just take blood pressure as an example, or cholesterol perhaps, right? You say, the first study is, look, people who have really high blood pressure, if you follow them, they do worse than people with normal blood pressure. So that's sort of the first study. Then you say, okay, well, if their blood pressure is really high, maybe we need to develop medicines to bring it down. And so you develop medicines and you show the medicines are effective to bring it down. So that's the second study. Then the third study is, now we're going to take all these people with high blood pressure. Half of them are going to get the medicine. The other half are not going to get the medicine. And we'll see which group does better. And the reason you have to compare them is because there is this thing called the placebo effect, which we understand, which is the sugar pill effect, right? Where people get a sugar pill and they still seem to get better. So in pharmaceuticals, you have to prove, or in devices for that matter, you have to prove that your treatment works better than a sugar pill, which is sort of odd to say because that means the sugar pill works, but it does. And so So what has happened is all of our studies tend to be, measuring sugar or blood pressure, cholesterol, or whatever it is. When you look at, things like stress, or you look at, anxiety or fear, or these other emotional sort of components of health, those are much more difficult to measure. And they don't lend themselves to scientific study the way you can get a number does. And so it becomes, now you still can do the study. I'm not saying you can't, but the studies are much more difficult to do. There's a lot more variables. They're a lot more difficult to design. And so that's at least part of the reason, I think, why we end up where we are.
Yeah, and so what's the greater mission then with Gratefully Well, that you couldn't particularly achieve inside medical system, and why gratitude specifically?
So as I started trying to practice this more preventive slash wellness kind of practice, which is not the way I was trained, I found a lot of things that were interesting. One is we really don't know that much about prevention. Outside of vaccines, we're just, we don't study prevention a lot because medicine is an illness-based model, because institutions and physicians make money on illness, we don't make money in prevention. That's just the way the financial model is set up. There's no incentive for a physician to go and, let's just say, prevent, like in cardiology, for instance, heart failure is a big spend. It's a big issue. And most of those are admissions to the hospital. Well, what's the incentive for the physician to prevent an admission to the hospital? When the patient gets admitted, he gets paid to admit the patient, he gets paid to see the patient, he gets paid to do procedures on the patient. If he prevents all of that, he's basically shooting himself in the foot, so to speak. And in addition, a lot of that prevention is education, and we don't really get reimbursed for education either. We get reimbursed for doing procedures. And hospitals, of course, they have no incentive whatsoever in prevention. And so it became a challenge to see, we don't even know when a lot of physicians say they practice preventive medicine, they do a lot of screening, early detection, like mammograms or PSAs or colon cancer screening and such. And that's early detection, which is very important, but it's not prevention. And so we understand very little about prevention. And so Gratefully Well was sort of set up to address, first of all, the people who come to Gratefully Well, they have to be willing to actively participate in their health and healthcare. Yeah. And they have to be accountable for their health and healthcare. So again, especially in the U.S., but you see this, I think, in Europe as well, we, again, sort of turn over that responsibility to the healthcare provider. And I'm not cutting the healthcare provider out of here. The healthcare provider, if you have migraine headaches, taking the medicines and preventing the migraines, very important and good. But it's not going to get to the root cause of your migraine headache. And so while you're taking the medicine, you need to address these other issues. So from my standpoint, I wouldn't say that migraine headaches are a mental health disorder, but there's certainly a mental health component to it. And so everyone with migraine headache should be seeing a therapist, as an example, or a counselor, right? Like, why wouldn't you? Yet only a very small percentage of them do.
Yeah, it's honestly fascinating. The wellness market is obviously growing exponentially, specifically for things like this, and everyone is opening up their mind to more cures than just the one prescribed by the doctor.
Right. So but it's all outside the healthcare system for the most part, right? Which is, again, maybe it doesn't belong in the healthcare system. I don't know. Yeah. But regardless. And so while I was sort of doing that research on prevention, what I did find was this whole body of literature on gratitude. And gratitude, actually, there are studies done that show that gratitude has beneficial health, physical and mental health benefits. And so I put that together in a book. And that's called the Holistic Health Pathways. And so gratitude was a big part of one of the tools, I should say, sort of after you sort of see, hey, this patient, whoever it is, and it doesn't matter whether you have a medically unexplained symptom like migraines or irritable bowel, or even if you have, a true chronic known diagnosed disease, like let's say diabetes is a great example. Diabetes is, yes, you do have to have the genetic predisposition for diabetes. We'll give you that. But diabetes is really a lifestyle issue. And so you need to maybe take the medicines. I'm not against the medicine, but in addition to that, people need to learn, what is it about their lifestyle, that is leading to this condition. And so, they need to become more active. I don't tend to avoid the term exercise. Live a more active lifestyle, as we talked about yesterday.
Yeah.
Try to not use the word diet, instead use nutrition. I say, try to, understand nutrition and what you should be eating and what you're not eating. And then ultimately most diabetics need to lose weight. But then in addition to all that, it's sort of like, why are you in this position, right? Why aren't you more active in exercising? Why aren't you eating, properly? And try to get an understanding of self-awareness of that whole sort of process. And so that's where we kind of try to work on.
Yeah, but I do think the biggest issue today that there's a lot of people without the education that aren't as self-aware, so they don't even know where to start. How do you feel about trying to attract these sorts of people? Is there anything that you're going to do outside of the box, or?
Well, I think again, yes. So the first thing is if someone is willing to at least look at this and actively participate, that's the first thing. As long as they're willing to do that, then I think they start to be essentially open-minded about some of these things, because we talk about some things that seem somewhat airy-fairy or woo-woo kind of stuff, like, for instance, thoughts, how powerful thoughts are in changing physiology, okay? If you sort of just went out and said, hey, thoughts sort of maybe don't create illness, but they are associated with illness, and you need to understand that. If you say that in our society, people start to look at you like, what are you really talking about?
I think you're kooky. Yeah.
Exactly, right? And so, but I'm only a partial kook because I start to bring in the science and get people to understand the mindset and the nervous system and how the nervous system interacts with those thoughts and causes the physiologic changes that you see. If you get startled, if you get scared, right? There's a response in your body. That's a thought. Hey, something happened, and your heart starts racing, your blood pressure goes up, and things like that. Those are powerful sort of physiologic changes that all occur from a thought. So that's where we kind of start.
And I think maybe back in the 90s you would have been seen as kooky, but nowadays I think people are much more, they're willing to open up their minds to this sort of thing. And I was thinking of you last night. I was watching The Sopranos, and in season 1, Tony is scared to tell anyone that he's seeing a therapist, really.
Right.
He's seeing a psychiatrist. He's scared to mention it to anyone. He doesn't want to getting out. And I was talking to my partner at the time. I was like, it's so strange that in today's society, it's so normal to go see a therapist. So hopefully the world is shifting, and these kind of cures or these kind of thought processes are much more acceptable.
Yeah, the improvement in mental health services, the techniques used in mental health services, and just the stigma that's associated with it, I think has, in my professional career, has definitely improved. And I mean, part of the issue, I think, back 30 or 40 years ago was, again, we didn't have great techniques outside of talk therapy, right, psychoanalysis, and medicines. And so everyone ended up being depressed and put on a medicine, and everyone did this talk therapy for the next 30 years. And they found out, whatever it was, there's some kind of trauma or something. And then they would anchor their symptoms or their issues or the way they were to that trauma. Well, and that's, again, the trauma is something you can't change. But today we have other techniques, like CBT and DBT and EMDR, all sorts of psychological techniques in mental health that are beneficial. So yes, I think we've made great strides, and I think we need to continue making strides as well in the mental health field, because it's just vitally important. Even, think about it. Even if I'll give you an example, right? Even if you have cancer, again, a known diagnosis, we've got studies that show that women with breast cancer who go to support groups live 50% longer than women with breast cancer who don't go to support groups. Now, if we had a chemotherapy that made women live 50% longer, like every one of them would get it. Yet only a small percentage of women go to, the support groups are offered, but they're not really emphasized. And so only a small percentage of women with breast cancer, as one example, go to support groups.
Yeah, it's an incredible statistic. So with your 40 years in cardiology, how does your approach to gratitude differ from what you'd find in maybe a typical just a mindfulness app or a self-help book, for example?
So again, the issue with gratitude is the studies are difficult to do. So there are studies out there that show benefit, and they show, for instance, you take a gratitude journal. If you do a gratitude journal, which is basically writing something you're grateful for, or 3 things, or 5 things, or 10 things every day, there's benefit. Those people do better, and I'm not questioning that by any means. However, there's also literature that shows the quality of the gratitude is important, just not the quantity of the gratitude. So, I mean, picture this: you're doing your daily gratitude journal every evening, and one night you get into bed and you say, "Oh, I forgot to do my gratitude journal." So you get up and you get out your journal and you write down, I'm grateful for my family and I'm grateful for whatever it is. You write down 2 or 3 or 5 things, whatever it is. And is there benefit there? Yes, there may be benefit there. I'm not saying that there's not. But again, the quality of that gratitude, or the inspiration you get from that gratitude, or the physiological effects may not be as effective as you can get in other situations. And so, again, I wrote about this in my newsletter, my early newsletter, the Gratefully Well newsletter, which is on Substack, about this, which is I call it the traceback method of gratitude. So it happened somewhat serendipitously in that I was in a depressed sort of state. This was now going back 20 plus years ago, and it was a Friday night. I was driving home, and I knew there weren't any groceries. I had to stop at the grocery store. And generally, I like shopping. I like grocery shopping. I like cooking. I like getting food and stuff. And so, but I wasn't feeling it this particular day. But I walked into the grocery store, and something, I'll call it magical, happened. Where in the U.S., the first place you walk into is the produce section. And I walked into this produce section, and I just became aware, and this incredible amount of gratitude came out, where I saw that all of this food was available to me, right? I look at the tomato, and I'm like, I didn't have to go get the seeds, till the soil, plant the seed, take care of the plant, watch it grow, right? And then pick it and all that. I could just buy the tomato, and it was there for me. And I just became, all of this produce that was available just became like the amount of gratitude just poured out of me, and tears came to my eyes. And then I went to the bread aisle, and there was 50 different kinds of bread. And I was like, wait a minute, I didn't have to like plant the wheat and harvest the wheat and separate the wheat from the chaff and mill the wheat and make the dough. And as I sort of thought about it, I started to realize all the resources necessary to get a loaf of bread to the grocery store that I could buy it. I was sort of complaining because it was $5 loaf of bread, and I'm like, I'm not surprised this isn't $50 when you think about all the people, the resources necessary to grow this wheat, to harvest it, to transport it, all the trucks that you need and the parts of the trucks that you need to do all that, and then someone's got to bake the bread, someone's got to package it, someone's got to get it, and all of that just is incredible logistics. And as I thought about that, it was just, my chest was going to explode. I was just it was an awe-inspiring gratitude. So, and the thing I like about the traceback method is that the gratitude journal is great. I guess I'm not knocking it, but you got to have a journal. You got to sit down. You got to have some time. Yeah. I did this on the fly, right? This was during, I was actually in a depressed sort of state, and so you can
the moment
exactly. So you can do this. Even you can use it to change the perception you have of an event, right? So if you're stuck in traffic, as an example, right, and you're running late, you can be angry, you can sort of kick and scream and yell, and the traffic, what happened, people are crazy drivers, there's probably an accident, all this kind of stuff. And if you look at your physiology during this time, it's negative, right? Bad things are happening in your body. The anger, the thoughts are creating your blood pressure to go up, your heart rate to go up. Hormonal changes are happening in your body. And so good things are not happening. If you sit there and say, okay, I can't change the traffic, this is what it is, right? And you say, I'm grateful that it's 98 degrees outside and I have a car that's got air conditioning, right? That you don't change the traffic, but as soon as you do that, all of a sudden you start to stimulate the parasympathetic nervous system, which is the autonomic part of the nervous system that calms things down.
Yeah.
And now your blood pressure comes down, your heart rate comes down, and then you say, hey, I've got this great, 1760 podcast that I've been wanting to listen to, and I can listen to that. And so I've got some time. And so the situation is not what's causing you emotional distress. Yeah. It's your perception of the situation or your interpretation of the situation. And that becomes very important. And that's a lot what we talk about.
So what's the journey that someone will go on with you to get to that state then?
It's a good question. So that is, the challenge here is that when I saw patients one-on-one in the office, I just worked with them at whatever level they were at, because it was a very one-on-one, obviously intimate sort of relationship conversation, as opposed to now with the digital platform where it's more education, it's more of group stuff.
Yeah.
And so I've needed to, and I'm working on this, create content that steps people through this. And so where I decided we need to start is with the physiology of thoughts. So next week I should have an email mini course, a free email mini course coming out on the physiology of thought. And so people will start to get this idea and then start with workshops there and then take it a step at a time to get people to understand to the point where, hey, what do these thoughts and this self-awareness have to do with my symptoms and or my illness?
Okay. So it's almost,
and that's not to say that, again, if you have cancer and you're getting chemotherapy, you absolutely continue the chemotherapy. We're not saying, hey, you don't need chemotherapy. But for instance, when my wife had breast cancer, she, I had a gratitude recording for her, and she would listen to this every time she was getting chemotherapy. And as she did that, she would go through the physician, the nurse, the technology, all the way down to the drugs, and it's not a positive psychology. It's more, I'm grateful for these drugs, letting them in a grateful sort of way. And, she had much less side effects than typical. Now, I can't say that was because of the gratitude, but at least when she was there, she had something, because as you're sitting there getting chemotherapy, you're there for sometimes 3 or 4 hours, and your thoughts start to run away with you. You're just laying there, right? And so this gives you a way, the gratitude, to, when you're ready, you don't have to do it you can do it at any point, but when you're ready to change those thoughts and to sort of focus on something else.
Okay. I think I need to start doing this a lot more then. But I've started 2026 off with the vision that to be happy, and by doing that I found myself getting less wound up by things, and I think that's definitely physically affecting my mood and my appearance. I feel much more energized, I feel much more alive. I don't know if that kind of ties into it as well. So it
probably does. It's just it's a choice. That's the important thing, is that all of this is a choice. The way you perceive life, the way you perceive an event, the way you perceive the event is neutral. It's your perception of the event that really causes you to be either happy or distressed.
So let's dig into the operational side of things. So how is the business structure today? It's a one-man operation essentially, and you have support, I believe, from a tech person.
Right.
How are you going through the motions at the moment? Because you're starting the business, you want to launch. I know there's a lot of different entities that you need to get aligned. How are you finding it all?
Overwhelming. So I knew it would be challenging. It's not that I've been wanting to do this for, I don't know, over 5 years. And that's one of the reasons sort of I haven't, again, how do I transform? But also, how do you do a digital business? Not what I was used to doing. And so I started with the newsletter, which, Substack is a great platform because anyone can start a newsletter. It's free, and you can charge as well. But so that seemed to be a good place. Plus, I like the audience, very mature sort of audience compared to let's say TikTok or something like that. So started with that, but then also knew I had to start to develop a community. And what I'm really looking for again is to develop grow a community of like-minded individuals who are willing to actively participate in their healthcare. So that was sort of the first thing. But how do you attract that community? Yeah. The newsletter was one thing, and then I'm going to have the website, which is right now it has the 7-day gratitude challenge, which has just gotten stale. It doesn't really reflect. This was a year ago, so it really doesn't reflect my thinking today. So that's going to change to the mini course, the 3-day physiology of thought mini course. What was happening is everything was. It first came out that it looked like gratitude was the foundation of the whole business, and gratefully gratitude is really more of a tool. The foundation is really this idea of mindset and choice. And so I had to kind of retool a little bit to do that. And then, of course, started to need to become more active on social media, which is, again, something that I knew existed but had never really interacted with. Started with that as well. Working on curating an email list, right, and being able to, segment that list and things like that is very important. So, working on all those things.
So, are you intending to start locally and then grow it, or are you trying for anyone and everyone at the moment? How are you intending to scale?
So I did these same type of workshops live 10 plus years ago. And they were fun and they were good. There were several days, we'd go somewhere and we'd have a group of, 8 to 15 people. And it was very enjoyable and very worthwhile. People got a lot out of them. But I think for this, it's the idea here really is to have a global reach. And this is not for everyone. So really trying to reach out globally. And most of these things are going to be virtual. I think eventually we'll probably have live stuff as well because I enjoy that. But for right now, it's mostly, these group workshops. I was going to develop courses and probably still will. And I think courses are great, but I found that I needed to actively participate in this, especially in the beginning, I think. And so it's either virtual kind of work groups.
But you've got deep clinical credibility that most wellness educators can't match, and it's all about how you're going to position your message and get it out there. Really, I feel. So, what's your current tech stack? Do you have an email platform? I know there's the website. Is there a course platform you're considering? Any CRM or automation tools?
Yeah, so we're setting that all up right now. So the CRM we're using is Zoho, and then trying to figure out some of the other stuff. Most of this is, as I started with a system called System with an E at the end, which is a very bare bones, inexpensive. It's a good system, but it's a very bare bones and limited in its, as for instance, in the email sort of stuff. So we had to add Zoho to that, and then we're. But for now, it's part of this is, as the expense of things. When I'm not generating any revenue, you sort of the expenses become meaningful, and so trying to figure that all out.
Okay, well, look, there's plenty of help out there to help you get started. So I wanted to kind of look at the vision for the future to finish off with. What does Gratefully Well look like in 3 to 5 years? So there are so many different angles you can go with this. So is this a course? Is it a community, a certification program, corporate wellness, or is it something else entirely?
Again, a great question. I see this first and foremost as a community. And so I really would like to build a global community, and I would love to be able to start, do the virtual stuff, but also do live stuff, everywhere, because I just find that meaningful. And helpful. So that's sort of probably the first and foremost. I think there will be, courses available and stuff as well, but that's not going to be the, sort of the main thing. Is really trying to, help people and support people through that and through the community. Now, there's also, there are physicians who are also interested in this because a lot of physicians don't know, they know the patient with migraines as an example, right? They don't know what to do with them. They put them on the medicine. Maybe they continue to sort of struggle. Maybe the irritable bowel, they've struggled with that. They're working on their nutrition. They're seeing a nutritionist. It's very important in irritable bowel to see a nutritionist and help with what it is that you're eating. But they're looking for another tool, and so this doesn't compete with anything they're doing. It's not sort of threatening to them, and so physicians are looking for help with this as well.
I think the partnership opportunities for you out there are endless. It's just about getting you in front of the right partners at the right time, so to speak. So last question, if I could wave a magic wand and with unlimited resource and give you unlimited resources and support, what would be the next big product or what would be the next big channel you'd launch?
I think eventually I would like to have a podcast as well. I think the podcast can be very helpful. I've seen a lot of podcasts like yourself and like others. It's just a powerful platform to be able to, people love the video, but they like audio, sort of as well. But getting that out there, and it's really about getting the message out. And again, I think this is just, as you said, there's already so much out there, say, on the mental health sort of field, and you can think this and sort of as mental health kind of approach, but I think that would probably be the next thing.
Okay, amazing. And look, you're a fantastic speaker, so let's get your podcast up and running.
I appreciate
So,
it.
Julius, this has been a fantastic conversation. What I'm hearing is someone with world-class medical credibility building something genuinely needed. Maybe a few operational pieces that could use tightening up, so you can spend more time on what you want to do, and that's creating and teaching. So it's been very exciting, and thank you so much for joining us. Thank you very much for coming on board, Julius.
It's been a great conversation. Thank you for the opportunity.
Cheers, Julius.
Thank you.
Bye.